Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us again this week, Ann Collette. She is the Vice President of Strategy and Business Development for Masonicare. Welcome, Ann. Thanks for joining us.
Thank you for having me.
It's a pleasure to have you. In your role, you spearheaded our communication efforts with our external audiences during this pandemic, including the media, a process which has been so very crucial. Can you tell us all how you approached this massive endeavor?
It's been an interesting year. I will tell you that just backing up a year, I've had a career in communications, crisis communications as well, and like many things, this pandemic presented us a completely kind of unprecedented opportunity to relook at how we do things. But some things in communication stayed tried and true. And, I will tell you that it's a huge responsibility to make sure that we're communicating clearly with the folks that are on the other side of these walls. That's a responsibility that I take very personally and seriously, as does everyone in our organization. When we reached a situation where there was a lockdown and we had residents in our care inside this building, and the only true means of day-to-day updates became our communication forum. It was really, really imperative that we got it right every day. And we had to come to terms with what getting it right meant as a communications team. So, we have a number of mediums. We've got social media, we have our web updates, and we do our filming and our videos and our press releases, and it became very important that the number one thing we could do would be to be extremely transparent in order to bring comfort to those on the other side of the walls who are concerned about their loved ones inside of our healthcare center. It was important that there was message consistency, that it was daily. We found that people that were calling looking for those web updates daily because it was all they had to connect them to their loved one on the other side. So in some cases, telling the story of what's going on inside of a healthcare center during a pandemic feels a little akin to being a wartime reporter, but it was so much more than that. It was telling the story, but it was also serving as some type of almost liaison to the outside world, in hopes of bringing them comfort during a very scary time.
Absolutely. And you did that with grace every day. And JP, I know for you, the most important thing has really been fostering that environment of open information amongst our team members, our residents, our patients, and their families, of course.
Sandy, it's one of the things that we pushed very hard at the start of our task force was making sure that we were out there communicating. And if you think about it, we're on day what we call 409 of our task force. Today's our 409th day of having our task force, our 380th day since we have had our first case. But at day one of a task force, part of our agenda was our communication. How were we going to communicate? And if you think about it, we actually locked everything down, stopped meetings, stopped visitations, stopped really pretty much everything that was in person, and had to find new ways or new vehicles to communicate to our staff, to our residents, to our family members, and to the outside public. And Ann and her group, which Sandy, you're part of that, have done an absolutely fantastic job. When you think about what we've done, whether it be emails, website changes, videos, think about this. What we're doing today, and Dr. Schwartz will tell us what number it is, but this is a byproduct of COVID. This is a byproduct of us trying to change how we communicate. And I will say this, I think this has been so successful that we're going to continue to do this after COVID comes to our normalcy. And I think that's something that there's some positive that have come from this. I will tell you the past year has been extremely stressful. Ann and I talked about it quite extensively, of all the things that we've had to do that you would have never have thought of. And now moving forward, looking to the future, things like these videos today, I think will stay with us as we move forward. But it has been an extremely challenging time. But those videos, the website, the talk with the media have all been very positive for us. And I think you're going to see more of that as we move forward. But Ann and her entire group have done an absolutely amazing job at thrusting out the communication and talking to the media in a transparent way. I think that has really been something that has been very positive to us as we have moved forward. So hats off to Ann and her group.
Thank you, JP.
Yes, thank you. I know our whole team has been honored to help every step of the way. And Dr. Schwartz, of course, the biggest medical news right now surrounds the pause that was placed on the Johnson & Johnson COVID-19 vaccine last week. What is the latest on that situation?
Well, Sandy, every time we do these shows, there's always something new with COVID, and there probably always will be. And I'll get to that in just a second. But what I did want to do is, share JP's pride with Ann. It's been great to work with Ann. She's been a major asset to our team. And so I want to make sure I say this correctly and read this correctly. But so Ann got an award through the Quinnipiac Chamber of Commerce Annual Women's Achievement Award. It's a lot to say. I want to make sure I said it correctly, but she was recognized as an outstanding innovator. So I think that speaks to what Ann is, what she does, and I'm really just an honor to work with you and have you here with us today. So I just thought I'd say that first before we turn to the business of COVID, which is now always on our minds. So you probably know, and all of you have been watching the news, seeing that there was a pause through the Johnson & Johnson vaccine last Tuesday. And actually they found, just 6 cases of a rare, blood clotting disorder. And it's a fancy word called Cerebral Venous Sinus Thrombosis. How do you like that word? Cerebral Venous Sinus Thrombosis. So that's basically like a stroke. Somebody, it's a stroke-like syndrome, but they found this in 6 women, and the women were aged 18 to 48 years old. So it's interesting, and they got symptoms between 6 and 13 days after getting the vaccine. The interesting thing, the Johnson & Johnson vaccine, and the interesting thing here is that it was associated with something called thrombocytopenia. So what does that word mean? Thrombocytopenia means low platelet count. So that's interesting in the fact that usually when you have a stroke, and a stroke can be 2 types of a stroke. You can have a hemorrhagic stroke where you have bleeding, or you can have like a clot, an infarct type of thing. And usually when you have the infarct, which is kind of what they were showing here, you have high platelets or a higher platelet count. In this case, the platelet count was lower. But again, this is 6 cases out of, at least at the time last week, there were 6.8 million shots that were given out. So it's not like it's a high number, but even so, the CDC, the FDA, had a meeting last Wednesday, and they looked at the data. And at the time, they just didn't have enough time and enough data to make a decision. So they decided to continue the pause for another week. And this Friday, there's going to be another meeting, the 23rd, this Friday, where they'll review the data further and make more of a decision as to where we go from here. So I just wanted to read a couple of statements that I think kind of summarizes, the FDA's point of view at this point. And this is a quote sort of regarding the pause on the vaccines. And they say, this is important to ensure that healthcare provider community is aware of the potential for these adverse effects and can plan due to the unique treatment required with this type of blood clot. So what does that all mean? Well, it kind of goes back to what I said before, that generally, when you have this kind of stroke, blood clot, you treat it with something. You have a higher platelet count, or at least some, possibly some abnormality with the platelets, and you treat it with heparin. And heparin is a blood thinning medication. In this situation, what you can get is something called HIT, H-I-T. I know you know what HIT is, but HIT is actually heparin-induced thrombocytopenia. How do you like that word? Heparin-induced thrombocytopenia, which means that, and it's not that common, but it does exist, that sometimes when you get heparin, it can lower the platelet count. So what they're trying to say is that as a provider, if I saw somebody that had a stroke, I might go right and give them heparin, but this could make the platelets even lower, and that's what's unusual about this condition. They already started with low platelet count, and you could induce bleeding or other kinds of problems. So part of this is to give providers a chance to kind of understand the syndrome and to recognize it and know that you need different kinds of treatment. There are other anticoagulation treatments aside from heparin that you can use, or other types of therapy. And then probably the final statement I'll just read came from Johnson & Johnson last week after this kind of unfolded, where they said, we are aware of an extremely rare disorder involving people with blood clots in combination with low platelets in a small number of individuals who have received our COVID-19 vaccine. The United States Centers for Disease Control, CDC, and the Food and Drug Administration, FDA, are reviewing data involving 6 reported US cases out of more than 6.8 million doses administered. Out of an abundance of caution, the CDC and FDA have recommended a pause in the use of our vaccine. So I think what that tells us, and this is what we've been sort of saying all along in these shows, is that the data is really being looked at very closely to make sure the vaccines are safe. Even to this extent of 6 individuals out of more than 6.8 million vaccines, I think we can be rest assured that we are being given safe vaccines, and if there is any question, it's going to be looked at very closely. So that should be looked at again as a reassuring type of thing. So having said all this, now I'm sure everyone is waiting for my quote of the week, which actually I found in 2 places. One in the Masonicare Charity Foundation calendar, and it's actually on the wall here in this boardroom. JP and I share the same thing of having inspirational quotes around, and there are quite a few in this room as well. But this is what this quote says. It says, it is amazing what you can accomplish if you do not care who gets the credit. Who said that? Harry S. Truman. So that I think is really important, because we really are a team. We don't care now who gets the credit. We just want to work together and get through this pandemic. And we are moving along. You see, this is the first show where you can see my goatee. We're not wearing masks, but we are all in separate rooms. And, and again, I do need to reinforce that when we are together, to wear masks, to socially distance, wash hands, avoid, large crowds, avoiding travel, and most importantly of all, continue to get vaccinated. So again, thanks to everybody for working as a team together, all your hard work. And again, I wish you health and peace. Thank you.
Thank you, Dr. Schwartz, as always, for sending us on the way with a perfect quote. And thank you all so much for sharing your time and these insights with us today. And thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.